I love medicine because it's just an amazing opportunity to be able to help people in your community.
Dr. Tito Daudu, a medical practitioner in Canada, is passionate about developing international partnerships to strengthen medical education in developing economies. Her first choice for the experiment was Nigeria.
As a resident, I thought, what are the kind of things that I can help or impact with the way that they're doing training, specifically surgical training in Nigeria. So I went to do a pilot project at UCH and as well as at the University of Calabar, where we started to look at what are the ways that we're training the house officers in surgical training, and to try to start to identify gaps so that we can start to build and facilitate programs that help those trainees when they're out doing their NYSC year or further along if they're doing residency training afterwards.
She is a young member of the Canadian Association of Nigerian Physicians and Dentists, canpad, an association that is of the opinion that it is time to channel developmental efforts to the Nigerian health sector without relegating the bulk of the initiative to the purview of the federal government.
It seems in Nigeria people believe that government has to provide hospital, government has to provide schools, but there are private institutions and churches and mosques that are rich enough to build 50 to 100 bed hospitals that can be fully equipped to what Nigerians call world-class standard. I mean, canpad as an organization can reach out to state governments. I've personally, I won't mention the state, reached out to one of my colleagues. I went to medical school with him, who's a commissioner presently in one of the states in Nigeria. And hopefully we'll be able to work some things out, just even on an experimental basis. Our colleagues in the US also are trying to do this, and I know some missions have gone ahead. But what we'd like to do is to have some degree of longitudinal involvement, not just to go for 1 week and come back. But obviously that will involve provision of maybe spaces for doctors to work. We're not coming to Nigeria to come and ask for money.
We get invited to various communities in both Central and West Africa. So we are keen on sharing our knowledge, and sharing our skills, and building capacity in these areas that we originally trained and were born and bred.
Dr. Tito Daudu and her colleagues believe Nigerians in other nations can develop similar platforms to mobilize professionals to work with the private sector to make Nigeria great. In Edmonton, Canada, Joy Usiagu, NTA News.